Hey guys, Nurse Joe Bear here again. So this one we're going to be doing an IM injection into the deltoid. So like we always do with everything, we're going to do our 6 rights. Right patient, right drug, right dose, right route, right time, and right documentation. So that's our 6 rights, okay? And then just like we do with everything, we're going to wash our hands, okay? Such an important thing is washing our hands. All right, so let's go check the MD order with the MAR and come on over. All right, so we're checking our MAR with the doctor's orders, okay? So according to the order, Pneumovax 1 milligram intramuscularly now. The vial contains Pneumovax 2 milligrams per milliliter. So just like before, we're just gonna do that math. So we have our 2 grams over 1 mil. Then over here we have 1 milligram over X. That's what we're finding for. Cross multiply them, okay? Do the math on that, and that's gonna come out to 0.5 milliliters, okay? So we gotta get all of our supplies that we're gonna need for this. Rubber gloves, like always, alcohol swabs. We're gonna use a 25 gauge, 5/8 inch needle and syringe. And we got our medication of Pneumovax right there. We got our medication vial. We're gonna check it. We're gonna make sure that there's no cracks on it. We're gonna make sure that there's not a whole bunch of like particles floating around in there. And we're also gonna check the expiration date on it. Now, if it's a multi-use vial and the cap's already off, it better have somebody else's initials, date and time, and when it needs to be thrown away on there. Otherwise, I'm throwing it away, because I'm not going to take the chance. I'm not the one who might have done that, so I'm just throwing it away and starting over, okay? So in this case, I'm going to pop this cap off, and I'm going to take an alcohol swab and clean the top of it, okay? Then from there, I'm going to open up my syringe. Very carefully. And just like we always do, we're just pulling back the plunger to get all that extra air out of there, okay? Now, we're gonna draw back the amount of medication we need, which we've already determined is 0.5 milliliters, okay? And then very, very carefully, I'm gonna take this cap off and set it down so that I can recap it before I walk down to the room. I can recap it if I have not stuck a patient with it. The second touch the patient, you cannot recap ever, okay? So very carefully, take that out, and then I'm gonna, again, face it towards me to my dominant hand, because that makes it easy to do this scoop technique with it, okay? So bevel facing up, start at 45 and go to the 90, and I'm going to inject the air into there. Now flip her over, and I'm going to draw back my medication. And I'm going to go a little bit farther so that I can make sure I get all the air bubbles out. I'm going to have to flick them. Very important to get all those air bubbles out of there, okay? Okay, pull it out nice and straight, and then I'm going to use the one-handed scoop technique. And click it back on, okay? Hey, Skip. Skip, can you tell me your last name and birthday real quick?
Skip Rocker 1172.
Thank you. Dr. Jumpy ordered for me to give you an IM injection in your deltoid, okay? So that's this muscle right here. Of course, I already washed my hands before I put my gloves on. And now, so how I find that spot is I'm gonna use my non-dominant hand, and I'm basically gonna make a little triangle. So I find your acromion process, which is that bony part right here at the top of your shoulder. Okay, yep. I'm gonna go 3 fingers down, and then make a triangle. So it goes like this, boom, boom. And then I'm going right in the center of that, okay? Does that make sense? Okay, and I want you to just let your arm hang limp, or you can rest it in your lap. I don't want you to flex that at all. I want it to be totally limp when I do this, okay? So I'm gonna find my spot on you. Here's our chromium process, 3 fingers down. And I'm gonna mark that spot because I see a freckle that I can use as a marker on that. So I'm gonna clean it. Clean that area real good. Let that dry. Okay. So now I'm gonna uncap my needle. And then I'm gonna set this down just in case I had to recap, but for the most part, safety, we don't recap a needle once it goes into a patient, okay? That's just a good rule of thumb, okay? So, with this, I'm going to find my chromium process, and I've already found that freckle again, so I'm going to be going right to that. A little poke here. Okay, and then I'm going to stabilize the needle, and I'm going to aspirate just a little tiny bit, just to see if I get any blood return. Because if I get blood return, I'm going to pull it out, start over, because we do not want any blood in there. Okay, there's no blood, so now I can inject it. Okay, and then we're going to pull straight out, and just like always, safety first, we're putting this directly into a sharp spin. Boom, that is good to go. Okay, and we're gonna dab that with gauze. Okay. Skip, how'd that feel, buddy? Wasn't too bad, was it? Okay, I'll wash my hands again. Okay, just get rid of all my stuff. Just gonna go back and I'm gonna document that the injection site, as well as that I gave that medication. Okay? See those cannons on Skip? Guy's yoked. That is an IM injection into the deltoid. Nurse Bear here. Thank you.